We are continuing our session on communication. Mr. Menon, would you like to add something when you are speaking on communication?
Yeah, the categorically communication is divided into 4 parts. That is, when you speak to a person, there are several levels of speaking that we call types of classification of communication. That is, communication is can be made, or it can be made in 4 ways. Just simply ask him, how are you? How do you feel? So it's what we call an open question. So he can answer from any point of view. Nobody is there to guide you, nobody is there to restrict your communication process. When I say you are good, you are okay now, you are okay now, that means I want either or yes or no answer. So what we call that is a leading question, yes or no. It has only short answer questions. The other is closed question. I feel you are now okay, so there is nothing more to be done. So there is no point of giving an answer from a patient.
So, what do you want the patient to be asked? Would you like a open question or closed question?
Open question is always suggested, because the patient will be given ample opportunity to explain his situation. So we will the only thing we have to do is to simply listen to what he says.
So, the question which we are throwing to the patient again is very, very important. And do you have any comments about being
Judgmental
judgmental?
question, that's what I was about to tell you. Judgmental, we all are always take the view that the other fellow is okay in all respects, but it may not be so 100%. He may have his own issues, his own problems, which he doesn't like to share with anybody else. So we take for granted, that is the usual terminology we use in palliative care. We take for granted that the patient is okay. Another hidden agenda is that we do not want to help him in any manner that is needed, because we want to see that something has been done, but actually we do not want to do anything at all. So this is judgmental question. So in judgmental question, the speaker or the person who is coming to the patient does not want to do anything at all. He wants to hear that the patient is okay in all respects.
Great. So, just to clarify more, judgmental means what you think in your mind, you are expecting the same from the patient, which in case of a palliative care is very, very wrong. You have to help the patient with his mindset. You cannot force the patient to adopt your mindset. So let us never be judgmental. We should, that is very important, that we should be having great listening skills. Once we listen to the patient, slowly and slowly we'll react to that. Immediate reaction is not required. So with that, maybe Mr. Menon, can you say something, because in palliative care we are learning and listening about sympathy, empathy, and
Yeah.
compassion. So would you like to elaborate on these issues?
Usually we say the padis. Padis means one is sympathy. When you are seeing a person falling, and we go near to the falling person, oh, it's a bad thing. So that's a form of sympathy. We do not want to do anything at all for the sake of his taking back to his normal position or something like that. Empathy is something different. We try to stand in his shoes. So we are trying to be the other person. That is the explanation given usually in empathy. So it is better always to follow empathetic responses. What you are facing now, how I will be of any help to you, like that. So another, the third point is compassion. Until empathy, we just exchange ideas or views and all those things. But when it goes to the next higher level, it is compassion. We become like the patient, we understand the actual situation of the patient, and we are ready to do something for the sake of the patient. That is the difference between empathy and compassion. Compassion is always welcome. In palliative care, people with compassion alone can do some jobs to alleviate pain of the suffering patients and their relatives.
So maybe just to explain it better, the person has fallen down, all of us see the person, we feel, oh, he must have hurt, and we keep moving. So most of the people do like that, even in accidents. But the person having empathy will come down, pick this person up, support him, and make him sit in a comfortable place. That is empathy. A person who is having compassion may further ask this person, do you need any medical attention? Would you like to be carried to a hospital? Do you need any medicines? And he'll help the person accordingly with the other needs. If he has to be taken to the hospital, he'll take him to the hospital, just get the things done and help the patient in whatever way it is required. Today, post COVID, all of us have seen the misery of the people across the world. And this is the right time we have to develop compassion in our hearts. Thank you.